I would like to welcome everyone to the Dayton VA Medical Center's Eligibility Enrollment webinar. We are thrilled to be here with you tonight. I want to start by saying this event is being recorded, so if you miss something during this presentation, want to watch it, rewatch it later on, you'll be able to do that. We will be sending you a link to the recording after this event. You can also share that link with anyone you feel may benefit from the information we're sharing here tonight. I'm Scott Leese with the Community Outreach Office at the Medical Center, and I am an Air Force veteran, and like many of you, once had questions about VA healthcare. Let's see if we can answer your questions this evening about eligibility, enrollment, and healthcare through the Dayton VA. Please realize that as a participant in this session, your microphone has been muted to minimize distracting background noises. We have quite a few folks on the webinar with us here tonight, which is why we're keeping everyone muted. Again, this is simply to ensure there isn't any excess distracting background noises. That doesn't mean we don't want to hear from you. If you have a question or a concern, you can share it with the panelists anytime through the chat pane. You should be able to find this pane at the bottom right of your screen. Simply type in your question and a presenter will get to you as soon as they can. For the sake of time, if we don't get to your question during this presentation, you can reach us by phone or email, and we'll provide that contact information at the end of the presentation. We will have a long, we've had a long history of veteran care here in Dayton. This year actually marks the 76th anniversary of the modern Veterans Administration. We are proud to be not only one of the oldest campuses in the VA, but also boast one of the newest and most modern medical facilities offering top quality care. Not very many people know that the VA is recognized, according to a study done by RAND, as being one of the top medical care systems in our nation. And it's also top rated by the veterans who it serves, with more than a 98% satisfaction rating. You're not going to find that anywhere else in the civilian sector. It's only at the VA that you get that kind of care. And it's also a benefit that's not available for everyone else to receive. This is only available for veterans. Wouldn't you like that kind of care? If you do, well, that's the reason we're here tonight. Let's hear more about VA healthcare. Before we take your questions, here's someone who can tell us about how you can enroll to receive this quality care. Chris Cox is from our Eligibility and Enrollment Office, and he is going to give you a brief presentation that goes into more detail about eligibility and enrollment with the VA. Chris, take it away.
Hi, again, thank you for joining us tonight for our eligibility enrollment webinar. I too am an Air Force vet. I served 6 years at Wright-Patt, and thank you for taking the time to be with us tonight. So to begin off, we're going to go over the agenda. So we're going to go over some of the common terms used, who is considered a veteran, the different types of character of discharge, criteria VA uses to determine eligibility, and then some other eligibility factors. So everything tonight from our slides comes from our VHA directive 1601A.02, which is our eligibility determinations. So some of the common enrollment terms that we use, registration. This is adding a veteran or a patient into our enrollment system, and that is our electronic health record. So enrollment, it's the acceptance of an eligible veteran into the VA healthcare system and assignment to a priority group. And ineligible, it's a veteran determined to be ineligible for enrollment. Rejected, income exceeds VA's national or geographically adjusted. And service connection, a veteran who has an illness or injury that they incurred during their military service or determined to be caused by your military, by the VA, the VBA, which is our Veterans Benefits Administration. Compensable, monetary benefits related to a service-related illness, disease, or injury. Non-compensable, this is not in receipt of any monetary benefits from VA for a disease, injury, or illness. Non-service connected, this is a veteran who has been discharged from active duty military and does not have a VA adjudicated illness or injury incurred or aggravated during their military service. non-service connection pension, veterans pension, and a tax-free monetary benefit payable to low-income wartime veterans. So who is considered to be eligible for health care? This is a veteran meets the basic eligibility requirements for VA healthcare if they meet the following. So their minimum duty requirement. So this would be 1 day of active duty service for the following individuals. So an enlisted member who enlisted on or before September 7th, 1980, or an officer on or before October 16th, 1981. Or this could be a member that had 24 months of active duty service for the following: enlisted member after September 7th, 1980, or an officer after October 16th, 1981. Reservist or National Guard members activated under Title 10 Executive Order for any period and completed the period that were called up to serve. Also, you'll need a character of discharge requirement, which is honorable or under honorable conditions character of for your discharge. So there are some exceptions to the minimum duty requirements, and that is an early out enlisted only. So this is for enlisted members. An early out information, this information can be found on your DD 214. Also, an exception would be to a hardship or discharge due to a disability that was incurred during your line of duty or it was aggravated. Veterans with compensable service connection disability, which you can file with your VBA. Contracted for a 15-month enlistment. This will be on your DD 214 as well. And then active duty for training 0% service connected, non-compensable National Guard reservist. So the different types of characters of discharge for enrollment, they must be under these 3 categories. So it needs to be honorable, honorable for VA purposes or adjudicated, and under honorable conditions, so a general discharge. And you can find that on your DD 214. So if a character discharge is one of the following, other than honorable discharge, uncharacterized discharge, or bad conduct discharge, this must be reviewed by the VBA. The VBA will make determinations, will be one of the following. So the character of service is determined to be dishonorable for VA gratuitous purposes. However, the former service member is entitled to health care benefits, or it will be not entitled to health care benefits. So to be ineligible for VA health care, so the characters of discharge, as we stated, is dishonorable or dishonorable for VA purposes. Ineligible duty requirements. So you do not meet the 24 months of active duty service after September 7th, 1980. And then for officers is the 1 day of active duty service. And was a reservist or National Guard member, never activated under Title 10 or Title 32 for emergency or civil disturbance. And then there's also tentative eligibility, and this is for in emergencies or based on military discharge, which we'll go over here shortly. So the tentative eligibility. So with this, the veteran must sign a VA Form 119. So it's a report of contact, and this would be you agreeing to pay for services if you are found to be ineligible for care. So this is what we call a humanitarian emergency care. This is something that if you fall under this and you are ineligible, we will still see you in our emergency department, but you will be stabilized and then transferred to a community healthcare facility. Okay, and then we'll open up for some questions.
Okay, Chris. Well, I think we have a couple here already. And thank you very much. That was some really good information that you've shared with us today. I just want to say, I'm your host, Scott Leese with the Medical Center. I am the outreach coordinator. I'm an Air Force veteran and will help answer any question you might have about the Medical Center in general. Chris will be glad to take any questions you might have about enrolling with the VA. So let me say also, if we don't get to your question within the time remaining, do not worry about that. We have your contact information and we'll be reaching out to you if we can. You can also call us or email us, and we'll give you that contact information later on in the presentation. So our first question comes from Joe, and he wants to know, what disqualifies someone from receiving VA benefits?
So you may be able to be disqualified on different situations, such as we went over, being dishonorably discharged. You can be barred from healthcare, from VA healthcare in general, or if you do not have any service connection and you are above the threshold for income purposes.
Okay. Mary is asking, is there a VA enrollment period like you find with the company's health insurance?
So, Mary, there's not the window like there is with the community insurances. So the enrollment and eligibility department can enroll you into our system throughout the whole year. You would just have to bring in your DD 214 to our facility, and then also there's other ways that you are able to enroll as well, that we will go over as well before we conclude this meeting.
Yeah. Let me piggyback on that question, Chris. So, for example, with TRICARE, it didn't used to be this way, but now there's an open enrollment period where you have to actually go back and re-enroll for TRICARE. But there's also premiums associated with TRICARE that a lot of veterans didn't used to see, but are having to see now. Do we have to pay premiums for VA healthcare?
So, no, to my knowledge, no. You do not pay for the premiums.
Right. There's no annual premium, or there might be co-pays for
Right.
some things, depending on
Depending
your
on your priority group.
service connected disability and your finance statement. But there are no annual premiums like other health insurance,
Right.
if I'm correct, right?
That's correct.
Okay. Ken would like to know, I've been told I make too much money to qualify. Here we go. We've gone down that road.
Mm.
Should I still apply for benefits?
So, as we were just stating, income is not the only way that you can qualify for VA healthcare. We look at a majority of things, whether it's based off your time served, sometimes your deployment locations, and also your service-connected disabilities can put you in a different priority group. So I always tell everyone that asks, should they apply? I always I always tell them to apply, because if you don't, then you have no opportunity. But if you do, there's always that opportunity that you might be eligible.
That's a great answer. Next up, Brian wants to know, once enrolled, am I always enrolled in VA healthcare?
So Brian, once you enroll with us, uh, you are enrolled. Depending on the priority group that you're in, you may have to do an updated means test every year, depending on which priority group you fall under. But I do want to point out that if you were to come to the Dayton VA, but then you move to a different state, and you would need to enroll with them at their VA to transfer in your care.
So, that's something we didn't really cover in the presentation, Chris, is the different categories or the different levels of eligibility. Can you explain a little bit about that?
So as far as the priority groups,
Yes, priority groups. That's the right terminology. Thank you.
so as far as priority groups, there are 1 through 8, and sometimes with the number comes a letter as well. Each one has a distinct capability. Uh, 1 through, I believe, 5 is ones that money is not a priority. And then anything from 6 to 8 is where copays start to come into play. The final one, which would be 8G, is ones that are rejected. They have no service connection, and they are above the income threshold.
And if I'm not mistaken, also share a little bit more about the fact that the way those categories are determined, or where you are placed in those categories is um, it's a variety of things. One
It
primary
is.
one is being your service connection and what disability rating you get. Correct?
That's correct. That is correct.
Which the higher percentage rating, the you have the greater services available to you.
Correct.
Uh, because I happen to know, for example, if you have I believe it's 90% or higher, you have dental included in that, correct?
So 100%, and then
100%.
also, or if you have a service connection that deals with your mouth. So
Okay,
myself, I do not have 100%, but I have a service connection that deals with my mouth. So I would be able to get dental care here at our facility.
right. And those are just a couple of examples of how people are rated and what category they fall into. Joy is asking, what is a VHIC card and what makes me eligible to receive one?
So the VHIC is an acronym. It's our Veterans Health Identification Card. So you may qualify for one of these cards if you are deemed eligible to receive care at our facility. So with these VIC cards, we used to use them to whenever you had an appointment, you would use that card, but that is no longer a thing. Uh, Sometimes people, I know myself, I loved having my ID badge whenever I could get on base. Uh, but if you want to use that to get to the commissary that's on base, you may use the VIC card. And then also for those lovely discounts that we get, so you don't have to carry around your DD 214 everywhere.
Right. Uh, does that card actually help you if you are traveling to get healthcare, especially if you have emergency healthcare that you may not be near a VA? Would you use that card for that purpose?
You can for that purpose as well. You should be able to also get pulled in if you have already enrolled within our enrollment system. So if you went to a VA outside um, of your state, you can have your ID handy and ready, so that way they can pull you up in the system.
Okay, great. Greg says, if I move, do I have to re-enroll if I transfer to another VA in a different state?
So, Greg, a great question. Yes, you would have to re-enroll. This is so that they can transfer all your care to go to that new facility. I would not recommend going in. So I know we've dealt with people who we call them snowbirds. So if you don't like being up here during the cold and you want to go down somewhere next to like the coast, such as Florida or Texas or anywhere like that, you wouldn't necessarily want to transfer all your care because if you do transfer, your appointments would get canceled here. So what you would do is you would just go down and re-enroll and let them know that you don't want to transfer in, but you just want to have your care there while you're staying there during
Right.
these cold months up here in Ohio.
So one of the things that you have to do for enrolling is fill out your VA Form 1010 EZ,
Hmm.
and you have to have a DD 214. Do you have to have that when you're enrolling in another facility, or are you already in the system? You just need to tell them to place you in temporary care there.
So every facility has what they call a 1010 EZ, which is our means test. And there's also one that's called the 1010 EZR. So once you've already enrolled, the EZR is the way to go. It's a more condensed form, but you would have to fill that out every single time you go to a new facility.
Okay. Mike wants to know, does having insurance affect my VA benefits, specifically Medicare?
Uh, Not specifically. So having other insurances allows the VA. So if you were to have a copay, we would bill that private insurance first. But as far as Medicare, with it being a government insurance, The government does not bill the government. So
And that applies for TRICARE as well, correct?
that is correct. TRICARE also falls under that government insurance.
Right, right. But at the same time, would you recommend that veterans dispose of their other insurance, or would you recommend that they leave those options open?
So it is up to the veteran to decide. I know for instances, if someone were to, for any purpose, need to go to the emergency department in a different state, or if they're traveling for a week and they had to go to the emergency department instead of going to the local VA, uh, it's best to have private insurance so that in case that does happen, God forbid, you wouldn't want to be stuck with a huge bill because you didn't go to the VA facility.
Right, right. Okay, Ted is asking, why does income need to be reported for VA purposes?
So our office needs to know your income to see if you're eligible for care so that we can get you into the highest priority group. Um, unless you have service connections, sometimes if you are below the income threshold, you may be able to qualify for all services, even if you don't have service connection.
Okay. And Rhonda is asking, what are copays?
So, Rhonda, a copayment or a copay is a fixed amount for a covered service that you're seeing here at the VA, and also in any private sector as well.
All right. And how is it determined who pays copays?
So that also goes into the priority group that you get set into. Some members may have copays, and if you're in the highest priority group, there are no copays for any service that you're
Right.
seeing here for our facility. Now, if you have a service connection, so if you're being seen for your ankle and you're service connected for your ankle, you would not have a copay for that because it's a service connected disability.
Okay. Bill wants to know, can my spouse be seen at the VA?
So who was that, Bill? Uh, Bill, unfortunately, no, only the veterans are eligible to be seen at our VA healthcare facility. But there is something for spouses that's called Champ VA, and we can add that number to our chat as well.
Absolutely. Yeah, if you could copy that in the chat, I'd appreciate it there,
I
Chris.
will. And for video purposes, I'll go ahead and just say it. It's 1-800-698-2411 as well.
All right, terrific. That's all the questions I have on my end. Did you see any others in the chat there, Chris, that I've missed?
I do not. No.
All right. Well, fantastic then. I guess we'll probably go ahead and wrap this up now, because we've got some time here. But if anyone has any questions, feel free to pop in the chat, and we'll get to it before the end here. But for
So,
now, we're just gonna.
so Scott, I
Yes.
do see one. There are the places I was deployed on my DD-214. Thank you for that question, Greg. Yes, they would be located on your DD-214.
All right, super. Well, we hope you found this event both helpful and informative. Oops, sorry, I'm bouncing around there on the slides. If we didn't get to your question, not to worry. You can call our eligibility enrollment office at 937-267-7608, or if you have any information about the PACT Act, which we really haven't talked about here tonight, but I probably should here real quick, is tell you a little bit about the PACT Act. That's the Promise to Address Comprehensive Toxins Act, which is legislation that President Biden signed into law this past fall, expanding health care to veterans who have been exposed to toxins in certain theaters of operations, and that if they have presumptive conditions. If you want to learn more about the PACT Act, you can call our PACT Act team at 937-268-6511. Extension 5807. Again, that's extension 5807. Or Go to our website at www.va.gov/PACT. There you will see all the theaters of operations and presumptive conditions listed to show what it takes to become eligible for healthcare, and oh, by the way, not just healthcare. Sometimes it's also compensation through the VA. And at that website, you can actually file a claim for the PACT Act, and they will do toxic screenings and to make a determination as to whether or not you would receive additional care through the PACT Act. Let's see. Okay, so again, we have several ways to enroll with the Dayton VA. First is in person at the Dayton VA Medical Center at the Eligibility and Enrollment Desk. That's where you'll find Chris and his folks, or any other community-based outpatient clinics in the area. You can also go to www.choose.va.gov/health and fill out an application there, or call the National Health and Eligibility Center at 877-222-8387, or mail a VA Form 1010-EZ. You can very easily find those online, and mail that to the Dayton VA Medical Center at 4100 West 3rd Street, Dayton, Ohio 4542. Again, you can contact us at the Medical Center at 937-268-6511, extension 25 or 2035, or extension 1398. You can also see our CBOC numbers there. Those are our local community-based outpatient clinics, and you can also call those offices as well, and they will be able to assist you. Again, go to www.choose.va.gov/health. That's again where you can find out a wealth of information about healthcare through the VA, and register online as well. I just want to take a couple more seconds here again and tell everybody thank you very much for coming online with us this evening. And I don't believe we have any other questions. Have you seen any other questions, Chris?
I do not.
Okay, super. So we'll go ahead and wrap it up this evening. And I just want to say thanks again to everyone who attended our event, and have a great rest of your evening. And thanks to all our veterans for their service to a very grateful nation.